Hi, I'm Derek Lido, host of From the Ground Up, a show that uncovers the not-so-secret strategies of owners of bedrock businesses. Featuring conversations with entrepreneurs who built influential companies, we're going to take a deep dive into how successful businesses are created without having to shoot for the moon or take unnecessary risk. In this show, we're going to teach you how many great companies are built from the ground up. Welcome to From the Ground Up. I'm your host, Derek Lido, and on today's show, we welcome Monica Moe, founder and CEO of WellSeek, a health and wellness company whose mission is to help others find supportive inspiration they need to lead healthier lives. Monica began her career in biotechnology, and she's also a member of the Council of Directors of True Health Initiative, a global coalition of leading health experts promoting the truth and health of healthy lifestyles that impact individuals and our society as a whole. So, Monica, thank you so much for agreeing to be on the show. And you have a really interesting sort of journey that led you to become an entrepreneur. But that's not what it sounds like you were headed for originally.
Yeah, no. Well, thanks for having me on the show. I'm really, really grateful to be here today to kind of talk to you a little bit more about what happened. Yeah, it was definitely a very unique journey, I think, when I speak about it. Just to kind of go back, I guess, to the very start. There's always that origin, right? My mom actually almost lost her life when I was around 12, when she gave birth to my sister. And that was really kind of that light bulb for me where I became really obsessed with understanding the fragility of life. And I really wanted to understand the way biology and health and how that all kind of came together. And, when you're a teenager, you're very impressionable at that age. So that really kind of put me in that rabbit hole, I guess you could say. You just kind of follow things as you go. So I ended up going to UC San Diego for my bachelor's and then eventually my PhD in bioengineering. I thought, okay, I'm going to become the scientist. I'm going to study biological systems and develop therapeutics and biotech. And I ended up in this very specialized area called metabolic engineering and systems biology, where you basically get to build these computer models where you understand the way your genetics and your nutrition, metabolism, and all these other biological parts in your body actually interact together so that it gives rise to different health outcomes, and then understanding how that can play a part into how you develop better therapeutics. I loved doing what I was doing. I thought, great, this is where I thought I was supposed to be. And then I kind of realized at one point how far upstream I was from really helping people directly. I felt a little disconnected, if that makes sense.
Oh, absolutely. I can empathize. I was trained to be a physicist, and I felt disconnected. And when I told my thesis advisor that I wanted to go work for a real company, he didn't talk to me for 3 weeks. So you didn't, take the path of becoming a researcher, but how did you get from there to be an entrepreneur? I mean, starting your own business.
Yeah. So, that was kind of when it really sparked an interest, when I just felt so disconnected. I think I was always the type of person who just wanted to be there with people, in the weeds and helping them. And when you're in science, at times you're in early stage R&D, you're kind of geeking out over this stuff, but you don't really know when it's going to actually make its way down, that path and really have an impact on people. So this sounds incredibly irresponsible when I think about it now, but I basically left my, nice, cushy 6-figure position as a scientist. And I said, okay, I'm going to start a business. And I actually had no idea what my business model was. I literally just had a name, WellSeek. I wanted to help people seek a better version of themselves, of their lives, of their health. So that was literally all I had when I stepped away. And, I thought, as I was kind of going into that at the time, digital health was, in the last, it was about 4 or 5 years ago, it was really heating up. So I thought, yeah, that's the way I'm supposed to go, health tech. And so I ended up raising a small round of, or a small investment round of for friends and family. And, I was like, okay, this is what I'm going to do. And I'm going to, learn more and about how to build a business.
And so your friends and family, were they worried about you, or were they sort of encouraging you and saying, okay, Monica, we're here. We want to invest in your idea is the most spectacular idea we ever heard.
I think at that point, I feel really fortunate that I have really supportive family and friends who really believed in me as a person, in my determination. I think that was pretty much the only thing they kind of went off of at that point. But as far as the idea goes, they were like, I hope it works out. So yes, they were definitely worried about, the route that I was taking. But as you kind of get through that process, you write out that initial business plan, you think, okay, this is what I'm going to do. So then obviously you study it, the industry more, you're trying to understand the market. And I ended up learning more about, these nutrition professionals, dietitians, who were essentially like the equivalent of MDs in the nutrition world, but were overshadowed by kind of Google, right? When you're looking for nutrition information, or even like all these wellness gurus out there who may not necessarily have the backing or background to really dissect that information for people. But those were the people who, they've been overlooked for so long. Right? They have that information, and they could really help people with their nutrition, eating habits. Yeah. So I thought, well, if I could help more people or more dietitians reach more people, then maybe that's how I can help more people. It's not just me, Monica, helping a lot of people with their health and nutrition. It was me helping and facilitating a lot of people so they can spread, be more widespread in that respect.
So, that is perfect embodiment of the fundamental principle of entrepreneurship, is that you figure out how you're going to make some group of people better off, happier, and happier enough that they'll gladly give you money in return. So you were able to reach all these dietitians and help them improve their business, and then they gave you some money in return.
Well, it didn't start off that way though. Okay. Yeah. So initially what I thought was, I would actually build a telehealth platform. So I would be facilitating the interaction between these nutrition professionals and the consumer. And, during that time, I was able to actually, have conversations, get some interest from different like healthcare organizations and insurance companies and some different corporate wellness type of organizations. And, but, I realized, as I was engaging with these stakeholders in the healthcare industry, as you can imagine, it's challenging. And quite honestly, I think a few years ago, the market just wasn't ready for it. If you think about nutrition, it's more of a ancillary health service, meaning it's not required. It's not like seeing a doctor or a dentist. So there wasn't a market for it, as I said. So that's really when I took a step back and kind of reevaluated what I was doing. I had to kind of ask myself, well, what wasn't working? And start to realize the real issue wasn't necessarily accessibility, right? Which is what telehealth would help with to dietitians, but there's more of a lack of valuing where true health information came from. So then I had to ask, well, what are people influenced by? And that's when it really hit me. It's really the way our media drives they're the ones who are the driving force behind our public's perception of kind of the most basic principles of healthy living. They overshadow it, with all these ideas of diets and restriction and kind of these fear mongering messages and plays to people's vanity. There's all these things that happens.
And so how did you figure it out? How did you figure out how to make this into a business? And it's getting farther and farther from laboratory work, and it's getting more and more into marketing and messaging and the like.
Yeah, no, it was, that was where I realized that it was, again, since it was media, then the only way that you can really kind of combat it is through media, right?
Mm-hmm.
So that's when I really kind of reevaluated the angle and approach that I was taking. So I ended up developing a business around brand consulting that would help these individual nutrition health professionals find more clarity in their message, so that they can connect with their audience and really rise above all those diet trends
Mm-hmm.
and fads that are floating around everywhere. And that was, I think that was what really kind of started, making everything go. That's where I was gaining the trust of this community because I was trying to help them more effectively connect with their audience. So it was almost like building a community of kind of micro influencers across the country where they can kind of go out there and make an impact within their own sub communities. And it was really cool to see that.
So I mean, that's a whole different skill set. What was it? Did you learn it by experimentation? Did you have some mentors? Did you, find people to give you good advice? How did you, get so skilled in this?
So I think I've always had a knack for storytelling as I was growing up, and that's something I've always loved to do. I even did that in my scientific research. I
Mm-hmm.
would, I was, I would read, I would put together these like experiments and like write all these things. And, but I always wanted to find like the narrative, the story,
Mm-hmm.
it's not just about the data.
Yeah.
It's about the narrative that you actually build with that information. So from there, I think, going into what these health professionals needed, most of them are clinicians, and that's the way they thought. So they
Mm-hmm.
would say, well, yeah, of course you need to work with me because of X, Y, and Z. But that's not the way the world works. People need to have that story. So I think I was able to kind of fit that skill set of understanding the science and being able to make it, like tell a story with it. And that's really kind of where it came from. But I also did work with individuals who are experts in the branding industry. So, like with my own company, I learned a ton from them. So like being able to kind of use, learn from, the people I was working with, and then also, what I was able to do on the science and health side, that just became a really nice, kind of complementary, skill set that enhanced my own.
So that's another, a classic that we see with a lot of entrepreneurs is that they uh, are able to parlay their, expertise, and you have several different expertises that you're parlaying into a business that you sell, as sort of a consulting business at first, and and then you use that as a platform to, to reach larger and larger audiences. So you you're really developing your brand way beyond just helping the your original target audience. It seems like.
Yeah, no, it's definitely, well, so if I think back to what my original vision was, it really was to just help consumers, right? Help people find, their health and happiness. But it was more, now I've shifted the way that I get there. So by finding, by working with these health professionals, these dietitians do it. That's one way, right? There's never just one direct route. The direct route didn't seem to work at the time. but by facilitating this, where I'm able to kind of build out their messaging around in media, that's another way to kind of reach that same endpoint that I was trying to reach.
And I understand at one point you wanted to go sort of the Silicon Valley route of entrepreneurship, and you went and did a lot of pitching and the like. And what what were you aspiring to do at that point, and how did that work out for you?
Yeah, I mean, when I first started, I think we know that media kind of portrays this very sexy allure of startup culture. There's the unicorns, investors, Silicon Valley, the show. So, you see that and you think, oh, that's like the only way you're supposed to do things. And as a complete newbie, obviously, I thought that was the only way to build a company. So that's really what I studied. But then I failed. I essentially failed at that. And I thought, okay, well, maybe this isn't the right route for me. There's definitely a time and place for it. But now the way I am building out the business through the consulting side first, it allows me to actually sustain a business. It allows me to actually create be in the weeds with everyone and create those relationships and the community. We've actually been able to build out a community of health professionals across the country. We have over is it a couple thousand now? It's amazing to be able to do that and really understand the market. I think that was actually really where I wanted to build my business in that way, to really be able to understand and just understand like how people are. And so yeah, I think that's sort of why I ended up in this route.
Well, again, it's this a classic. You're fabulous role model in so many ways. But in the U.S., there were about 600,000 companies started last year, but only 1,400 of those were actually funded by VCs. Right. Really, really small number. And that number, 1,400, by the way, it's been flat for 20 years. So, we have this, impression that entrepreneurship is booming and creating zillions of new businesses where ultimately the Silicon Valley model is very flat, and it needs to be. It's important for some types of businesses, but businesses such as yourself are far more typical of how value really is created in our society.
Yeah, no, I can't agree with that more. I think a lot of the times, the way maybe VCs will look at a market, right? Because that's really what they're looking at when they're trying to decide if they want to invest in you. Is there a big enough market? And in some ways, they're trying to understand kind of, they're kind of forgetting the fact that, markets are they do know. They know it's very dynamic, but it's also about how do you understand the tendencies of people, right? Because that's what a market is. Yeah. It's understanding the probability of a person's ability to take action. And so that's really where I ended up actually. So beyond the consulting company, I thought, well, there has to be more. I need to actually build out a media platform that embodies the voices of my entire community, because without that bigger platform where everybody has that unified voice, then people are just going to think, oh, well, I don't know what I'm supposed to believe. So that's actually how I started my publication platform, which is the WellSeek Collective. And so now that's something that we run, which is a contributor-based platform with all of the health professionals that I work with. And that's And so, over time, as it continues to gain traction, that's something that I see as something that can influence the market, not necessarily just reacting to a market. And I hope, that's the route that I'm trying to kind of go towards.
And it's reacting to a need of your customer base. It helps the entire community, this community that is coming to rely upon you more and more for how you're helping them, and they're gladly, helping you in return.
Yeah, no, it's actually a really lovely and beautiful synergy. I think I'm trying to remember the statistic, but I think it's like 96 or 98%. I mean, not much of a difference of women as dietitians. So it's been incredible to be able to connect with women all across this country and just helping them understand that they do have the capacity to become an entrepreneur and start their own small businesses, their private practices, and be able to influence the people in their communities and helping them. And that has been honestly the most rewarding part of this whole process.
And so, you weren't successful in getting venture capitalists in Silicon Valley to be interested in you, but you've done a really great job of getting all of these partners to, talk about your business and to help you and to, be part of your team. And these are big companies. How did you do that?
Well, the companies I've partnered with are all other small businesses too,
Okay.
where agencies,
Mm-hmm.
it honestly started out as a necessity.
Mm-hmm.
I had to bootstrap, or I was bootstrapping. You have to be very resourceful, and there's already a lot of these amazing consulting businesses out there, with really talented people who are just really great at what they do. So it was just a matter of kind of finding the right people with like a complementary skill set that really kind of enhances the value of what we're trying to bring to the table. So, for example, the design, the creative consulting company that I work with, LR Creative, they actually started off, they were actually the in-house creative team for a very successful e-commerce fashion company, but they came out and did their own thing. And I thought, like a lot of these health professionals don't understand like aesthetics on their sites and the way their brands are built. So I thought this is the best way. Like I need to bring this fashion eye, right? To make their brands even better. So that was why, I partnered with them. The other company, Wellevation, they're a great company for activating these brand and influencer connections. So a lot of, brands will want to work with different social media influencers to help, talk about their products and really create those relationships. So I started working with them to really kind of understand, areas around how the brand industry, food brand industries work. So, yeah, it was like building out our team as like this network of independent small businesses. We align on a very specific mission under the WellSeek brand. And then we just kind of find these opportunities and go for it.
So, what's the thing about being an entrepreneur and responsible for your own business that gives you a sense of well-being, personal well-being, that you're doing what you're meant to do?
Yeah, I mean, if I think about why I started the company in the first place, I wanted to be able to help other people, but I think I was also really trying to carve out that definition of health for myself at the time when I really initiated this. And it was really, you know, and by starting this company, I essentially started embodying all the values, right, that we are trying to push, like help other people realize through our media. That it's so much more about, it's not so black and white. Health isn't black and white. It's really about understanding that you have to find what works for you, and And at the end of the day, you just need to have trust in yourself and gratitude for the life that you actually have in the present. These are the messages that we share through our media, and it's become my inner dialogue as a person. And it's actually really helped me grow as a person. And I think, as an entrepreneur, you are on this very long journey of self-discovery. And being able to do that in a way where I got to explore and also come to an understanding that, this is how I want to help people. And this is these are the messages that I need to hear for myself. Well, these are the messages that other people need to hear because my life has changed because of it. So yeah, I think it's all kind of, the personal and professional side just kind of naturally kind of came together.
And what are the things that you find most challenging? What are the things that you've got to, gear yourself up for?
Gosh, on a day-to-day basis, I think time management for me. I am a mom of two, so it's challenging, right? Finding
Yeah.
you kind of have to work your schedule around, when are the kids going to be up, when are their school drop-offs and all these things. So having to kind of navigate that has definitely been, yeah, the most challenging part of it. But at the same time, I can't wait to get up at 4 a.m. every morning because there's more to do. Like it's the same thing where I'm like, oh, well, I have to get up at 4 because the kids are going to be up at this time. Like, but I can't wait to do it. So, yeah.
Yeah. Well, I mean, that exemplifies when you found the right thing, because ultimately, creating your own company is a long-term commitment, and so it's about being excited, getting up early every morning that enables you to keep on refreshing your business and keep on caring about your customers.
Yes. No, it's I get to I mean, every day I get to actually talk with my customers, right? Or my potential or my audience. And that's exactly what I wanted, right? I think I felt too upstream in early stage R&D, and now I am directly talking to people like all the time. And that definitely, keeps me going at all times.
So, what are your sort of important objectives with WellSeek, and what are you planning on doing to build on this platform that you've created? I mean, a very solid bedrock platform.
I certainly hope so. It certainly feels like it.
Yeah.
And I really want to continue diversifying kind of different brand and media consulting opportunities through our company. Just work with more health and industry players, larger organizations who share that same mission and initiative. So that we can build a platform that really kind of influences and guides the way our market will respond, and really helping people lead to this like more sustainable, healthy lifestyle, rather than these quick fixes, which is really what our current market touts. And beyond that, I'm just looking to create more visibility for a media platform, to just reshape our health culture.
Well, you're such a great role model, for entrepreneurs of all genders, and because ultimately, you are delivering on your passion, and you're doing it in such a way that it helps many other people, and does it in such a way that those people are happy to, give you money in return and be part of your community, and now count on you more and more for their business. So you're doing something that's really important for our society.
Oh, thank you. I hope to live up to it.
Well, I look forward to staying in touch and following your journey as you
Yeah, that would be awesome.
expand. Well, we've reached the end of another episode of From the Ground Up, and I'd like to close by thanking you so much for giving us the time and sharing so openly your experience here and building your Bedrock business that's becoming really successful, and so many healthcare professionals are relying upon to help them with their businesses. And so Monica, a real thank you. I'd also like to thank Microframe Media, who I'm using to help produce these shows. But most important of all, I'd like to thank our audience that sort of tunes in and is so intently interested in learning about Bedrock role models such as yourself, Monica. So thank you again, and I'm sure we'll be in touch.